Hi everyone, I am in Texas for the San Antonio Breast Cancer Symposium, and let me tell you a little bit about SABCS. So this is the largest breast cancer conference in the world with attendees from all over, including physicians, patient advocates, other health professionals, pharma industry, everyone is here. And just to give you a scope of how much science is being presented at the meeting. So once you register, you can download everything that's being presented, and that document is over 3,000 pages. And that doesn't even include the data that's still embargoed and not released until the day of presentation. So it's an overwhelming amount of content. Now, this content varies. The science is anywhere from basic science work, things that are going on in the lab, some of that early translational work, going from basic science to the clinic, clinical trials in all stages, first in human, very small clinical trials, phase 1, phase 2, the large randomized trials, phase 3, real world experience, analyses, things that are looking back, retrospective analyses. So, the amount and the scope is really, really enormous. And what I think is really important to highlight is that there is a lot of data being presented. Not all of it is practice changing, meaning I'm going to do something different in my clinic come next week. But a lot of that sets the stage for more development, more studies, and so everything happens in stages. Now, sometimes it can be frustrating when there isn't practice changing data for the type of breast cancer that you may have or that you're interested in. But an important point is that everything really happens in stages, and sometimes it'll feel like a meeting has a lot of triple negative breast cancer information, and other times a meeting has a lot more HER2 positive information or so forth. And a lot of that has to do with where the studies are, how they're reading out, and everything like that. So I just say that to kind of, when you hear what's coming out of that meeting, some of it may be applicable to you as a patient, as a caregiver, as a friend, as a healthcare professional, and some of it may not be. And again, that varies. With that said, I'm going to share as much as I can this week about things that are exciting, maybe practice changing, things that are going to shape how we practice oncology. There's a couple of studies that I am really excited for. So these are kind of bigger studies that are being presented in the general sessions. There's a lot of great poster sessions and posters being presented, and I'll try to highlight those throughout the week. But some of the studies being presented in the general sessions that I'm excited about, one, and this is a big one, is the ZEST study. So this is a study for patients with BRCA mutations or triple negative breast cancer that have a positive circulating tumor DNA and no radiologic evidence of progression. So positive circulating tumor DNA, positive Signatera test, and then they have scans and there's nothing on the scans. And this is a really challenging situation for us because normally we don't have anything we can do. So the ZEST trial took that population of patients and randomized them to placebo or to get a treatment drug with a PARP inhibitor called niraparib, and the brand name is Zejula. So I think the study is going to be super, super interesting. That's one. I'm excited to see the results of the COMET study, which kind of looked at low-risk ductal carcinoma in situ and whether we could avoid surgery. Similarly, there is a study of tamoxifen only after surgery in good risk DCIS, and we'll find out what that means, and omitting radiation. So I really love this concept of pulling back. We're going to see some novel new drugs being presented. We'll see the results of the EMBER-3 trial, which looks at imlunestrant, which is an oral selective estrogen receptor degrader for hormone receptor positive, HER2 negative metastatic breast cancer. We're going to see other novel drugs as well, and I will share those. I'm also looking forward to a study on risk reducing surgery and impact on survival in BRCA mutation carriers who have been diagnosed with breast cancer, and a meta-analysis of over 200,000 patients with breast cancer and weight, and prognosis. So lots to come. This by no means covers it. I mean, the list is really endless. I have to cut it off somewhere, but please stay tuned. Let me know in the comments what you want to hear about this week, and I will do my very, very best to cover as much as I can. Follow along.